All right, well, I'll guess we will just start. So we'll start with that, and then we'll... all right, so the business with daimai is that any kind of twisting that people have, which means that can mean, back pain issues or, well, and I'll show you about shoulder. It can show on daimai, okay, because it's an axis of twisting, okay? So before you needle gallbladder 26, you needle kidney 7 to release gallbladder 26. That's the dogma, and then we can needle gallbladder 26. We do that a lot, like, for example, for shoulder pain. They can't raise the shoulder. Often the problem is in the pectoralis. Gallbladder 26 releases the pectoralis, okay? And also, if my...
Slow down a bit. Can you slow down a bit so I can take notes as well? So, comment on, was it kidney what?
Kidney 7. Kidney 7. Kidney 7 releases gallbladder 26. Okay? So you find if there's tension on gallbladder 26, oh, that was early. If there's tension on gallbladder 26, you release it with kidney 7, then you can actually needle gallbladder 26, and you can needle more than one. You can put 2 or 3 needles. What you're referring to is with the arms lifted, you're stretching gallbladder 26, and you have more space. And we like to needle gallbladder 26, does a better job for trigger finger sitting up. Okay? So rather, at the end of the treatment, you'll have them sit up and then you'll do gallbladder 26. And again, because when they're sitting up, there's a gravity kind of pulls it down and narrows the space in gallbladder 26. You ask them to raise the arm so that you can find and, you have more space to find gallbladder 26. Okay? But also, there's situations where you can ask them to raise the arm because they're coming because of shoulder pain. If gallbladder 26 is tight, so now you're going to have to watch me for a second. If gallbladder 26 is tight, you see how I can't raise my arm? It's because of the pectoralis is pulled. It's the same inside my body, not just in my shirt. The moment I release gallbladder 26, so inguinal, the arm can go up. Okay? So we use gallbladder 26 a fair amount for shoulder pain, for back pain, for knee pain. Any sort of twisting is a gallbladder 26 indication. And if you actually find something on gallbladder 26 before you needle it, you'll use kidney 7.
Yeah.
Okay? That's the big deal.
Yeah. And there's also in her books, I think when she's assessing whether the structure's right, she sort of like up and then twist.
Yeah.
And if the creases are different on each side, then it indicates something.
Okay.
That we're not straight.
The thing is, some people can't. Okay. The thing about gallbladder 20, usually with the shoulder, it's going to be the same side, gallbladder 26. The thing about doing this is you can see, like, remember the person yesterday that, she can like, the hips go here and the chest goes totally the other way. It's kind of, and she can't do the same thing on the other side. So you want to see the flexibility of gallbladder 26, but there's no, as far as I recall or know of, there's no like protocol that comes with it. You're just kind of looking at the capacity of movement around gallbladder 26. And in order to do that, it's just that when you do it with the arms here, okay, if you just watch me this way, let's say I can move to the here and then I can only move to here. Okay, if you just watch my torso, it may not be so easy to see. But if you watch my arms, you can see, the movement of the arm is much bigger, so that's why it's a little easier to do that. With regard to hip higher and stuff, who has back pain besides Diane, who's not here? Okay. Low back pain, preferably? I mean, you're coming in late. Okay, someone with back pain who doesn't mind their buttocks exposed.
I don't mind, but my back pain's in the upper back.
Yeah, so you're not so good.
I don't mind.
Okay, either one of you, I don't care. Okay, so this is Kawai's pen treatment. I need a ballpoint pen from someone. One that, yeah, this is actually a good one because, okay. So you're going to stand here with your hands touching the table. But don't lean forward. So get closer to the table. Okay, thank you. Feet slightly apart. Can you take your feet a little further apart? Mm-hmm. Okay. Okay. It's interesting. I thought the left was higher, but I think the right is higher. Okay. Okay. Where is your pain? Okay. Well, we'll try to. Because when I put my hands, it feels to me like my left hand is higher. But when I'm looking at it, it looks to me... Well, we'll try it with the left. Okay. So what you take the hip that's higher, okay? And you ask her, take this leg... let me show you what you're going to do. Okay. You're going to take the left leg out. Mm-hmm. Something's going to happen. Then you're going to leave the left leg as far out, but take it slightly back. I'm exaggerating slightly. And then I'm going to ask you to take that leg back again. That's why your hands are on the table. You're not leaning any weight, but once on the third one, it may not feel so comfortable. Okay? So take this foot out to here. Not quite that. No. That's good. Oh, okay. Oh, so you see what happened? It dropped. This dropped as soon as you took it. Okay. So take a deep breath in and out. This will hurt. It's just a pen. Deep breath in and out. Deep breath in and out. Okay. Now take this leg back to here. No. Yes. Thank you. Okay. I'm going one vertebrae up. Deep breath in and out. Deep breath in and out. Ooh, interesting. Deep breath in and out. Okay, take this leg back. I think we should have done the other leg, but we'll find out. Deep breath in and out. Deep breath in and out. All I'm doing is pressing the pen in. Deep breath. Only, yeah, right. Deep breath in and out.
Pressing it on what?
First in the middle of the spine, come back. And then on the paraspinal. So you can literally you can see the pen marks, right? This is not mine. So, okay, how does the back feel now?
Yeah, it might feel more... Normally I can feel them out.
Hmm?
I can feel the hips being out, but I can't say which one would be out now, so maybe something feels different.
Okay. Yeah, her problem with you, it's like the tailbone gets stuck out somehow. Okay. And you have no way to, you can't connect with it.
No.
Yeah. She may be more of a stomach 30 type. Let's try you for a second.
Okay, was the higher hip you were taking out?
It's the higher hip. Okay. If I have this hip higher, okay, the moment I take the leg out, you see it fell more into place. Right. And the further back I take it, the more it's going to drop. Okay. Yeah? So that's kind of what you're trying to do. And then you're basically activating the paraspinals to sort of get them used to this idea of like that hip being there. Make sense?
So it was more right sacroiliac.
You have right sacroiliac pain. Okay. Why don't you have a bra so we can leave the shirt up there? Yeah, you're definitely right side higher. Okay. Take this leg slightly out, just slightly. Oh, okay, good. Okay. Take a deep breath and out. Deep breath and out. Deep breath and out. Okay. Take this leg back. Okay, good. Deep breath and out. Deep breath and out.
Is that quite a lot of force that you're putting on there?
And out. It feels quite a lot, but actually all I'm doing is this. Deep breath. Leg back a little bit more, but keep this one straight. Yeah. Deep breath and out. Deep breath and out. Deep breath and out. Sorry. Yeah, very tight here. Okay. Come back. How does the back feel?
Kind of feels better.
Yeah?
Yeah.
That looks different even from here, actually.
Yeah. So Kauai does this a lot. I mean, so I do this at the end of the treatment. I'll have them stand up. And, you know, the only thing you have to decide is which leg goes out.
What point do you stand on at the bottom in L4?
L5. L5, S1. You know, I mean, you know, the assumption is we believe we know which vertebrae we're on, but you don't start at T7. Let's put it this way. Somewhere down there, I don't think it makes a huge difference which is which. Okay?
And how long will that last? Do you need to redo it each time?
Yeah, I would probably do it, you know, people with back, you know, like, you know, the second time they come in, I'll probably drop it afterwards. I'll probably do it 2 or 3 times, you know. I mean, it's an extra.
Yeah.
You know, it's not their treatment. It's something that, you know, kind of is an extra thing. But the thing is, it's also very useful because, you know, say you're, you know, in a restaurant somewhere, you can get a pen. You don't always have needles, you know, available.
Yeah.
Or it's not, you know, or you don't have points available.
You were doing it in the centered line and out?
Center and then on the paraspinal. So you can call it inner UB line if you want. I'm not sure. I would say it's probably a little closer in than the
Watos?
No, not the Watos. Definitely not. Okay, can you stand up and we'll show them the...
Do you want me to walk around? The priest's got a pen.
Okay, yeah. Show you back to everyone.
Yep.
But I'm assuming you can still see the pen, right?
Yeah.
You can see the pen marks.
Yeah.
Okay, so that's...
Thank you.
Good morning. Where's your back pain? Yeah. Didn't you say you had back pain yesterday?
I had.
I know you had a whole bunch, but we were going to treat you later. But yeah.
It's more now. I've got drop foot because I had a big prolapse and it cut off the nerve supply and all that kind of thing.
Oh, okay. So it's not going to relate to this.
I don't really have. I've got a bit of a weak back, but it's not really.
Okay, it's not a back pain. Okay, it's a different story. Okay. All right. Are we good with that? Okay. So that's my understanding of the gallbladder 26 thing.
Thank you very much.
So you're welcome. So what I thought we would do this morning before we start with Tim is maybe for the next 45 minutes, do a review of like protocols, but go at it rather than go at it from the abdomen perspective. Like if you find this now, go through the treatment points, you know, and kind of almost like reverse engineer it near it. Okay? Yes.
Could I just ask, do you use your gallbladder 34 in a similar sort of ways to when you use your GB26, then, in the sense for like the torque and the twisting and motion?
Yeah, they are related. They're strongly related. For example, gallbladder 34 we use also for wrist, and gallbladder 26 also. The difference is gallbladder 26 for the hand will be same side, gallbladder 34 will be opposite side. So yeah, they are strongly correlated.
Wrist, same side wrist?
Wrist, gallbladder 26 will be same side, and gallbladder 24 will be opposite side of the wrist. 34, sorry. 26 same side, 34 opposite side.
But it's not a case of like those two would typically always be done together for shoulder or...
No, actually I would say they're very rarely, it will be very rare for me to do them together.
Because you would test one or the other?
It's an interesting question. My sense of it is that gallbladder 26 is a very particular twist on this axis, Whereas gallbladder 34, there's something, gallbladder 24, 34 is, it's almost, the twist here is it's quite gross. The torque is generally, it's much smaller parts. So it's the kind of thing you're not going to see. Does that, like this you see. The thing with the sacroiliac, unless they have one hip high, unless it really pulls a huge amount, it's a much smaller kind of situation.
So what would be the most typical thing you'd have GB34 used for then?
Sacroiliac.
Okay.
Yeah, definitely sacroiliac, and or for rheumatoid arthritis, for wrists. But gallbladder 34, the most common use of it is sacroiliac. Okay.
Okay. Yeah. Cool.
Okay. Whereas gallbladder 26, the most common use of it is inner knee eye pain, L4, L5 pain. It's not so good for sacroiliac, gallbladder 26, relatively speaking, and shoulder, pectoralis stuff.
And just to ask then, with lower back pain, do you normally find then that there is some structural problem and that would have to be addressed?
In all likelihood there is. It's like, in other words, I'm not a big believer in kidney deficiency and back pain.
Yeah, that's all.
I just don't find, treat the kid. Does kidney 7 do a good job for a fair amount of back pains? Yeah. But is it like for example, spleen 9 is actually the point for L4, L4, L5, for example. So, yes, back pain often can be either structural, but it can be internal, but the internal may not be necessarily what we will define as kidney pain, as kidney deficiency. It could be, there could be menstrual issues, there's a whole bunch of things that, so because I don't differentiate so much, when people come for a sports injury, I still care about the medical, I'm still treating everything. Like, what's your medical history? And, you have a thyroid issue. I'm interested in treating your thyroid issue to see what the effect is. But you can't ignore the fact that they're coming for a structural issue. Just like you can't ignore when they come for shoulder pain or elbow pain, like no matter how much you treat their thyroid or the heart disease or whatever it is that you're claiming to be treated, you need to address that, and that can have a structural component.
And you would put down the fact that so many people have lower back pain just because of the way the back forms, and then this is a very easy axis to go out, and there are lots of sort of things that could go wrong with it. Like
Sorry,
menstrual.
I missed the very first part.
Because people get a lot of lower back pain,
Yeah.
it would be considered in TCM because a lot of people are kidney deficient. Whereas you would say people get a lot of lower back pain because there are just lots of things that can go wrong in that area structurally because of the way the back hangs and.
Both. I would say it is. The problem with a low back is. Structurally, right there and then, you have a problem that this is the one place in the body where there are no bones to support you. Between the ribs and the hips, all you have is the lumbar spine, which is narrower than the sacrum. Okay, so you don't have the capacity to just like plump, and when you do, you're going to get back pain. So since most of us are like with your legs, you just kind of like, they're going to hold up no matter what you do because it's bone, there's a bone at the bottom and there's a bone at the top, and they're going to align one on top of the other. Well, in the back, especially in the lower back, there is no supporting bone structure. It has to be held by soft tissue. If the soft tissue is not working in the legs, the bones are still holding you upright. If the soft tissue is not holding you in the torso, you're going to end up with pain because the soft tissue is going to rebel. So it's the activity of the muscles is much more needed to support the torso than it is to support anywhere else. And if the person doesn't have it, and you get, and they get misaligned, they're going to have, going to start having problems. Does that make sense?
Yeah, absolutely.
So.
Also, if you have organ problems,
They will reflect on the back.
particularly a large bowel, that will cause a lot of lower back ache.
Yeah, yeah.
Because the capacity for the bowel
to push into the back. Yeah. So, for example, Miriam Lee used to really love doing large intestine 4 for a lot of low back pain. So, yes, it's very successful for the people where, the intestine is really at fault. So. Okay, review. All right. So we'll start at the arm, and we'll move through the different sections of the body, and then hopefully we'll get through all of it. So we'll start with immune point. Okay. So somewhere between large intestine 10 and 11, usually closer to 11, but on the edge of the bone. And the tissue here has a certain feel, okay, that I associate specifically with immunity, because immune also has back pain on the top of the posterior iliac crest is also immune-like. The area right under the scapular spine is also related to immune. Below small intestine 12, we use that for lymph, both lymph drainage and for infections, lymph infections. So that tissue, that weird way that the muscle adheres here at the top, is very similar to the way the muscle adheres to the iliac crest, and very clearly similar to the tissue below the scapular spine. Okay. Your reflex for that generally would be Sanjiao 16, possibly right side stomach 27. Okay, so I'm basically trying to give you like points that we use lots, so that you can kind of
27.
right side stomach 27 may be a reflection of immunity. Okay, and so if you're looking at which reflexes we use immune points for, is right stomach 26, 27, Ren 12. We resolve often with immune points, and Sanjiao 16. And then back pain, when they come and they say, my back pain is across like this, iliac crest. Okay? So, yes?
Could I just ask why those particular areas reflect immunity or treat immunity?
That I actually don't fully know. What I'm trying to say is that that tissue, I was talking about the feel of the tissue here and the feel of the tissue under the scapular spine, and often at the iliac crest, there is something that feels in your hand very similar. That's all I can say about it. I can't say why they are, so I don't know what the connection is between immunity and that, but there apparently is. Or we believe there is. Okay.
You said back pain across the lower back?
Yeah, like they say like this. It's not the sacrum. It's not in the center. It's like this. That tends to be immune point. Now the other type is, there's a type that they lie down, and they say it hurts when I stick my tailbone down, when I arch my back, or when I curl under. Again, they're activating this area of the iliac crest is moving. That's an immune type back pain. Okay, the type of person that lies on the table, and you ask them, can you produce your back pain, and they go like this. That's immune. Okay. Sanjiao 8.
Sorry.
Yeah.
You said something about Ren 12. I didn't quite catch that.
Immune point is one of the big things we use for resolving Ren 12 pressure pain. Okay. The other things that go with Ren 12 are stomach chi, kidney possibilities. Kidney 7 or kidney 9 can be good for Ren 12. Okay. But immune, we will get to immune for Ren 12. Okay. And the other big use for immune is for temporal headaches. They have headaches here. We use immune, same side. And we would probably use more than one needle on the immune point.
One general question very neatly.
So if you put a needle and it does no change or little change, and you put a second needle and then you get a change.
Yes.
Do you need the first needle?
You might as well.
So you have no.
Officially, you're not supposed to reuse that needle anyway, so it doesn't hurt to leave it in.
Would you consider the effect because of synergistic effect?
You don't know. That's the problem. You don't know. So, hold on one second. So, ideally, you palpate, and the problem is that you can put a needle in, and since your finger is bigger than the needle, you may have missed the point with the needle. And that's where, but sometimes even with palpation, it's very clear that you need more than one needle. It can happen. So, yeah, if 2 or 3 needles do the job, don't take the first one out. Just leave it in. It's totally fine.
And this is considered between different points as well. So I put like kidney 7 and then I put kidney 9. And there I get a pronounced effect, while before I didn't get any real effect.
Oh, no. That would, no. If you put in kidney 7 and you didn't get much of an effect, that needle should not even be in there. In other words, if you pressed on kidney 7 and you got a great effect from kidney 7, and then you put a needle in, okay, and the effect isn't good, that needle comes out and you re-find kidney 7. And if it ends up that after a few tries, that no matter what you do with kidney 7, it's not giving you the effect, you let go and you go, oh, well, kidney 9 is going to give it, and you happen to get the effect you want from kidney 9 with the needle as well, kidney 7 was not your point. Somehow on pressure it did it, but with the needle it didn't. Now you can look at angle of needling, you can do all sorts of things, you can manipulate needle to try and get more out of it, but it doesn't make sense if a point didn't give you the effect you wanted. Then what is it doing there in the first place, sort of thing? Do you see what I'm saying? So, now immune point, we needle because the arm is bent like this. So needle down and laterally. Okay, so if their arm is here, I needle towards me, basically. Okay, so the angle is important with it.
So towards the bone?
It is towards the bone, yeah.
Are you able to find the sort of gummy bits you find? Are you able to find sometimes when you palpate?
Yes, that's what I'm talking about. It's that gummy, but it's almost like a swollen tissue where the muscle adheres to the bone. It's that swelling that I'm looking at, and that swelling relates to immune. Now, I can make up stuff about it. Oh, that's really an inflammation of something. I don't know. I don't know why it relates to immunity, but it does. Because the same kind of tissue you get in other places that I am associating with immunity. So, Sanjiao 8. I just slide my hand up until it stops, but you can say it's about 1/3 down from the elbow. Also, with Sanjiao 8, if it doesn't work for you there, stop moving. You can move slightly up and down, and also you can move towards the small intestine channel. You can move more lateral. And again, the needling is lateral. We use that lots because, number one, it releases opposite side SCM, meaning it releases the autonomic nervous system. Okay, so, that's probably one of the, immune and Sanjiao 8 are probably the biggest point usage, I would say I have in my clinic, okay? Releases the SCM opposite side, releases the cervicals on the same side, cervicals. On the side. Well, but if it's cervicals, it might be on the third side, I don't know. So cervicals, same side. And also it would have it, so for someone said yesterday, if you have lots of finding in the abdomen, would you do, I can't remember what you asked me if I would do, but one of the first things I would consider is Sanjiao 8. Because if I release, lots of stuff, and because, let's see what happens. Oh, they asked me about, tiger worming the ear. Okay, it's the exact same principle. By tiger worming the ear, where the endocrine point in the ears, area, you're hitting the vagus nerve, you're stimulating the vagus nerve. Sanjiao 8, you're basically releasing the vagus nerve. The hope is that if you release the nervous system, the abdomen will relax, and now you'll find out what's what's really important, as opposed to, well, I have 20 findings. What do I do with that?
So you would needle Sanjiao 8 and then go back to palpation afterwards?
Yeah, or, well, I would press Sanjiao 8 and press, because if just needling it means I haven't tested, then I'm like back to the problem. Oh, Sanjiao 8's not effective. Do I leave the needle in or take it out? Press, test. If it seems to do a decent job, needle it.
Yeah.
Now with the needle in, you're saying I got rid of X percentage. I'm going to assume that whatever I have left is now the real stuff that's worth dealing with, that's not just autonomic nervous system problem. And because before you have so many, you go, well, is it kidney, is it spleen, is it this, is it this, is it, now you have a little less, and you're going to assume that that's the core of the issue. And you could be wrong, but that's okay.
Yeah.
At least you got a place to start with. Okay.
You needle towards the bone again, you said?
Yeah, same as
So you go across.
immune. Yeah.
What's the difference between there and under the third toe?
Well, they are relatively good friends, but actually Sanjiao 5 and under third toe are better friends, because Sanjiao 8 generally we use for slow or regular pulse. If it's a rapid pulse, we would tend to use Sanjiao 5. Okay?
To do the same things?
To do the exact same things, yes. Okay? Now, under the third toe is a point for autonomic nervous system. Originally we called blood pressure point, but it is for autonomic nervous system, especially if the pulse is a tight pulse, meaning thin, wiry, and disappears or changes quality on pressure. Okay? But under third toe is generally the points in the feet, or under the feet, but liver 1, for example, is another example. They're better for rapid pulse. Under the third toe is not called for with a slow pulse unless that pulse is very clearly a tight pulse. If you're confident this is a tight pulse, you can do under the third toe even though the pulse is 50 beats a minute.
And the tight pulse changes when you press it.
It's generally thin. It has a to it, like a wiry quality, hardish quality, but it's not an excess pulse. And when you press on it, it either opens up and becomes like soft, slippery, or it literally the pulse disappears. One or the other. Okay, so Sanjiao 5 matches that description because of the rapid business. Sanjiao 5 is a little bit a better match for under the third toe. Okay, but yes, you can certainly do Sanjiao 8, because Sanjiao 8 is also for regular pulse, not just slow pulse. Regular pulse and under third toe is totally fine.
Irregular, did you say? Irregular.
No, regular, yeah. Irregular pulse. First of all, irregular doesn't mean, well, yeah, he can change speeds also, so that's not really. Irregular pulse, the two things, well, if it's skipping beat, okay, two things you should consider with irregularity. Plain irregular, always assume they have oketsu, or really check. That's the one place where oketsu, liver 4, lung 5, is still like of great importance. You know that I'm kind of like, one of my big things is, oketsu used to be big in the 90s and things changed because diseases, the way we respond in the world has changed. Okay, so in the 90s it was a time of, good economy, everything was fine, everybody had a little bit too much wine, too much cheese, and oketsu was a big deal. Oketsu is not a big deal nowadays, and then we started having adrenals, and now we see a lot of Ren9s. Okay, so there's a clear shift in what we find and therefore what we treat. Okay, but liver 4, lung 5 is still a good treatment with people with irregular pulse. For skipping beats, you can consider liver 4, lung 5. The thing that I would consider, this is outside of treating cardiac and stuff, okay? I consider gallbladder 39 and gallbladder 5, 6, or I don't know, whatever the names are, but, and this is the reason. Gallbladder 39 is called Xuanzhang, and there are 2 gallbladder points, I can't remember which is which. One is called Xuanli and one is called Xuanlu, meaning, and Xuan is hanging, and there's one more Xuan as far, I think there's just one more Xuan, which is the dew point, dew 5 is Xuan, Xuan Shu is what it's called, hanging, hanging axis. Okay, so, and it's a shu, not like a shu point, like tian shu, stomach 25, like ling shu. So it's different, not transportation, but axis. Okay, the character hanging, okay, Xuan, is composed of, there's a heart underneath, and above is like suspended. It's that it's the thing is suspended, but what's suspended in the character, I mean, the translation of it is suspended, right? Xuan is suspended. But what in the character, what's actually suspended is the heart or the mind. Therefore, I'm assuming that points with Xuan in them, with hanging, okay, are good for when the heart or the mind stop. It's hanging. It's like hanging, yeah. So, and but I mean, these theories are kind of cute, but the thing is, does it work in practice? And I can tell you that in practice it does work. Gallbladder 39, and one of them is called Xuanli, and one is Xuanlu. One is hanging, hanging hair. So it's like they have little, what would payas be in English?
The what?
Payas.
Oh, yeah. Dreads.
Dreadlocks, yes. Not dreadlocks, but yeah. What?
Ringlets. Yeah.
Ringlets. Okay, they'll have, if they have ringlets. So because the point is like where the hair for the ringlet starts, right? So but the other one is hanging skull. Okay, so you can look at if it's hanging skull, these points, and that I don't have the experience with, but you can try that also. Could it be good for stroke? Because in stroke, also the mind has gotten suspended. So that I don't have experience with, but for regular pulse person, for skipping beat person, I do have the experience that gallbladder 39 and gallbladder 6, 7 are good for that.
6, 7, not 5, 6.
Whatever. I don't know.
Well, I'll look it up.
Somewhere here, it's like 5, 6, isn't it 4, 5, 6, 7? They're all very close, and it's like I can't tell which is which. It's like something here.
Yeah, I think it's 5 and 6. 5 is Xuanlu, is it?
Yeah.
6 is Xuanlu.
Yeah. Okay. 5 and 6. That one. But yeah, because gallbladder 7 is the above gate, because it's above stomach something.
7.
7. Then that's gallbladder 3.
Gallbladder 3.
Yeah. Then that's the wrong one. But
The
somewhere here.
irregular. Would you notice the irregular pulse actually becoming regular while you're doing the treatment?
No, that I don't have the experience, but it resolves a lot of their abdominal findings, and after a few treatments, well, I'm thinking of a particular person, one particular person, and the pulse totally stabilized. So no, I didn't find it on the table, because one of the things about skipping beats, well, this one in particular, but with skipping beat is that there is it's differentiated in many ways. There's regularly skipping and irregularly skipping. So if it's irregularly skipping, you can't guarantee what you're doing, and sometimes they can go for 5 minutes without a skip. And some people say they feel it all the time and very regularly. Some people say they feel it all the time but irregularly. And it's very confusing for the mind when you have that, and if you feel it. Some people don't feel it; it doesn't mean anything. But some people actually feel it in their chest. So you can imagine that if it's regular, it's one thing, you get used to it. But if it's irregular, it's like it totally shocks you. If you don't feel it, it's not. I feel it in someone else's pulse. They don't care. But if they can feel it, it's a very disorienting situation. So, okay, the other points on the arm. Lung 5 we use lots because for asthma or breathing problems or bronchitis. The only thing about lung 5, sorry for the other theory that it's supposed to be, we take it not next to the tendon, just lateral to the tendon. We take it slightly further to the side. Okay, and you can play a little bit going up and down if you want. You can test a better point, but don't take it right next to the tendon. Okay, and just as another note is that our pericardium 3 is not medial to the tendons, but is in the middle of the two tendons. Okay, so we just have a different way of looking at it. Pericardium 4, which I use a lot. In general, we use pericardium lots. Okay, because it's related to the autonomic nervous system. Okay, so checking pericardium 8 and deciding, do I do pericardium 3 and 5, or do I do pericardium 4 or pericardium 6? One or the other.
Can you just go a bit slower?
Sorry, yeah.
Say that again.
Pericardium, you check pericardium 8 for pressure pain.
Okay.
If there is pressure pain, you do pericardium 3 between the two tendons and 5. Okay. If there's no pressure pain on pericardium 8, you can do pericardium 4, 3 fingers below pericardium 3, or you can do pericardium 6. You decide which one you'll do according to which one does the best job on the abdomen and or the neck. Okay?
So I didn't understand why would you be checking
Pericardium 8, because on the pericardium and the kidney, when we're about to use pericardium and kidney, we always check the fire point. We don't do that on every channel, but on the pericardium and the kidney, the checking of the fire point is significant.
When you were about to do what?
If I want to use kidney channel or I want to use pericardium channel, I check pericardium, the fire point, I check kidney 2 before I go out and needle anything on the kidney, because that's going to give me a big indication of which points to use. It doesn't mean, like someone asked yesterday, it doesn't mean I have to do metal water if I find pressure pain, but I might. Okay, and if I'm not going to do metal water, I better have a good justification to myself why I'm not. Okay, fire point pressure pain is not 100% metal water, but it's 95% metal water solution. Okay, you could stray from it, but it gives you a very strong indication. With the spleen and the liver, for example, we're not that concerned. If there is, in other words, I don't check fire point on liver and spleen on everyone, unless there's some reason, like digestive issues, I would check. Okay, but with pericardium, if I want to use the pericardium channel, I will check pericardium 8.
Do you then test the metal and fire point before you needle them?
Yeah, then I test okay. I don't test them against the fire point. I test them against the abdominal findings. Okay, so for example, the person had adrenal. I want to do something on the kidney. Okay, I now check kidney 2. Kidney 2 pressure pain, I check kidney 7, kidney 10 against 4 o'clock, 8 o'clock. Okay, if it's successful, I needle. After I needle, or maybe even a few minutes later, I check how's your kidney 2. Okay, and hopefully it's better. If it's not, you can manipulate the kidney 7 and 10, because the main thing is less the fire point is a finding, but the thing that I want to change the most is the abdomen. The fire point is secondary in terms of my ambition to change it. Okay, it's more of a it's an indicator of what point to use. But the truth is, the abdominal findings are also just indications of what points to use. But I'm more interested in changing the abdomen than I'm interested in changing the fire point.
Yeah, that makes sense.
Okay.
Very, very quickly ask. With your kidney 10 location, do you come from round the back of the leg and go into? You don't go from the side like sometimes people can.
Well, I'm coming from the side because I'm not lifting the leg up. But in a moment when we have a person on a table, I'll show you. Remind me to show you that.
Yeah.
So.
Have you ever used pericardium 4? So you said a couple of uses.
Well, pericardium 4 is a good point to send blood to the abdomen. And it's also a good point for any sort of blood disorders. So it will take precedence over pericardium 6 because of that. However, for anemia, you can use either.
Either 4
4 or 6.
Yeah. It used to be that the official point for anemia was pericardium 4, but now the official point for anemia, I understand, is pericardium 6. So you're gonna have to choose which one does a better job for that patient according to how much it moves in the body. And since for many people, 6 it's a little bit more it's a more sensitive point. So it's kind of more convenient for me to use pericardium 4. But I do check one or the other, and I see what it does.
When you say send blood to the abdomen, what do you mean?
Meaning, so for example, a lot of gynecological issues, there's just not enough flow in the abdomen. So it's literally, think of it as pumping blood into the abdominal cavity. That will be true for digestive issues, for example, also.
But it's like a cold when it's really cold.
Yes, if you feel, well, except that if you're feeling, okay, there's two kinds of cold in the abdomen. There's the kind of cold that's on the skin. There's the kind of cold when you press. The skin can be warm with that type. The skin could be warm or cold, but you press inside and your fingers feel like you hit an iceberg. That cold is the pericardium 4 cold, not the skin cold. Okay? The skin cold is more of a nervous system kind of thing. The deeper cold it's a deeper circulation issue. Okay?
For skin cold, is normally...
Skin cold can be just autonomic nervous system. The deeper the ice cold is like really lack of circulation. So the organs are deprived of blood at that point. So that deeper cold is the one you want to use pericardium 4 on. Just because the skin is cold, that's not an indication of pericardium 4. Okay? Yes?
Can I just ask, there don't seem to be a lot of the shoestring points used in this style. I just wondered if it's like a Japanese, Chinese cultural thing, or sort of, because the Chinese...
Of course, For the Chinese say that the shoe, well, we do use shoestring points. We use, for example, spleen 3 a lot. So it's not like we're, but yeah, you're right that relatively speaking that the Chinese love liver 3, they love kidney 3. We don't... well, P7 I would not say is the most popular point ever. Pericardium 6 I think is by far does pericardium 7. But heart 7 is, okay, so we use heart 7 for the obese type and to release the clavicle. But otherwise, heart 7 is not a big deal for us. Heart 3 we use for one-sided L5 pain or one-sided C6, C7, T1 pain. Okay? Heart 7 we use for the obese type patient or to release the clavicles. For example, somebody has kidney 27 pain, we use heart 7 for that. But the point that we use more, if there's a point that we actually use on a heart channel a fair amount, it's heart 3, which we use for one-sided L5 pain or one-sided T1, C7 T1 pain. Okay, heart 7 is a good friend of gallbladder 26 and kidney 7. It's part of a twisting kind of syndrome. By the way, heart 3. Heart 3 is a good friend of kidney 7. This one is water on fire, and the other one is metal on. There's a relationship in terms of 5 elements. So gallbladder 26, kidney 7, and heart 3 all relate to twist. And Lawrence, gallbladder 26 is a twist. That's what I think I was trying to say, that it's a bigger situation. And gallbladder 34 is a torque. It's a thing and versus twist. There's, in my mind, there's some differentiation. I don't know if I can transmit what it is that I'm differentiating.
Yeah.
So
the twist is kind of a bit more ballistic, isn't it?
Yeah, there's more volume. Yeah, it's going to be small, but it's going to have a big effect in terms of pain. So hold on one second.
Heart 3 for one-sided pain or one-sided C7 T1 pain.
L5.
Ipsilateral or contralateral?
I can't answer because I never know which is which, but same side. Okay. I would tend to say ipsi, but that's okay. Yes.
A lot of these things might be one-sided. Is that normal that you go for same side?
Generally, yeah. Generally, most points work same side for same side, with the exception of triple warmer 8 for opposite side SCM, and spleen points can cross. However, when I'm starting to look at is a point good for you on a constitutional level? You know, so in other words, you know, under the third toe, let's say, and I'm looking, or even Sanjiao 8. Well, no, because that one has both sides already right there and then. But let's say spleen 9. You know, you're a spleen 9 type. I can use spleen 9 and see if it affects the abdomen. Yes, if I'm pressing spleen 9 on the left side, it's going to be much more powerful for the left side of the abdomen. But if it starts fixing things on the right side, then I know, yes, this really is a spleen 9 type. This is not just a point that happens to help. This is like, you can call it your constitutional point, if you want to use that term. Does that make sense? So, and you had
the same question.
Oh.
Is your part 3 in the same location? Just off.
Slightly more lateral, I would say. I think you guys use it here, and I think I would go a little bit more towards small intestine 8. Heart 3. So yeah, I think all our elbow points are a little bit different. You know, heart 3 is a little bit more medial, I think. Pericardium 3 is right in the center, and lung 5 is slightly more lateral than you would take it.
The follow-up on the question I asked was, you seem to answer, the answer seemed to be about when you test it as opposed to when you needle it.
If I tested and it worked, then I needle it.
Yeah.
So there's no, to me, there's no differential. If you tested and gave you a positive result, it implies a needle.
Yeah.
If you tested and it gave you no positive result, then it implies no needle. So I don't differentiate.
Can I just double check?
Yeah.
So say, adrenal, you're doing kidney, and you look at 27 is really painful on them.
You might needle heart 7,
So we need to clear this pain again
Ideally,
fast
yes.
before then. So
Yes.
the kids cycle going.
Yeah. I mean, you don't want to get too much into it. That was one of the problems with the guy yesterday, is that then you get into, well, the cycle would have been enormous and you had nothing to use anyway within the, you know, so that at some point you have to make a decision. Now, this is the kind of person that eventually you will decide that you are going to needle things with pain. I just wouldn't want to do it first time.
Yeah, we try.
You know, you do best you can to avoid and see what happens when you go gentle. And then, you know, listen, I have patients, and these are especially patients who came from a TCM person and like them. You know, they got good results from, you know, I had this shoulder pain 5 years ago and the guy just stuck 2 needles in my shoulder and I got better. And, you know, as someone like that, there's a really good chance, you know, it's not 100%, but there is a decent chance that no matter how sophisticated I get on them and all the remote points and solving all the abdomen and blah, 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 and they go, still hurts. And no matter what you do until you put a needle there, they are not going to say the pain is better. And it's not just like, you know, because some people respond to Ashe. They basically told me pretty much in advance that they will. Okay? But I'm being me and I want to do what I do. I don't want to do what someone else does. So I do my thing. But eventually I'm kind of like, okay, I guess the other person was right. You know, you don't, I mean, you know, it's idiotic for me to say no. I mean, it's just like, I use cups, I use gua sha. Now, I've never seen Kiiko do it, and I'm sure, you know, she thinks that what I do is barbaric. So yes, according to the Japanese ideologies, that's not totally, but hey, it bloody well works. Why not use all the tools you have? You know, I'm only offering one more option. It's not like, you know, if this option doesn't work, it's just like a point. This point didn't work, what's the next point? This style doesn't work, what's the other style that I could, you know, steal from any style you can. You know, it's not, no, also Kiiko is not a pure style. You know, I'm sorry to say, but you know, it's not like she has breeding papers, you know, from a kennel or something. It's like Kiiko is a mishmash of, you know, mishmash is a little bit rude maybe, but you know, she took from Manaka, she took from Kauai, she took from Nagano, she took from many people and combined it and made it something that's hers. You know, and now people are gonna, you know, and lots of people take from Kiiko certain points, and they're doing it totally on a TCM ideology. It's totally possible. There's nothing wrong with it. You don't have to be a so-called purist, because there's nothing pure about what I do. There's nothing pure about what Kiiko does. And who knows where Nagano got his stuff. He never talked about how he arrived at it. Purity is not, you know, you don't have to trace your lineage to the Ling Shu. You know, we just do it because it's kind of, you know, oh, well, in the Ling Shu it says this, and doesn't it match my ideas? Oh, yeah, okay, so, you know, okay. Shall we continue?
Could I just get you to repeat again? Heart 3, same side, T1 and...
T1, C7 if they have one-sided, or L5 one-sided. In other words, not if it's on both sides. And you needle it on the same side. Heart 3 is also a good point to release the scalenes. Other points that release the scalenes are spleen 3 and inner yin and lung 8. So there's 4 points that release the scalenes. You can do all 4, you can do 1, whatever works best for you. Officially, the dogma is spleen 3 is the stronger one. Okay, spleen 3, inner yin, heart 3, lung 8. Now, releasing the scalenes is a big deal. Okay, well, it's a breathing muscle, so it affects everything, and it's also we do not classify it as an autonomic nervous system indication, but it is, because when people they tired and they can't breathe, you know, from all the tension that we have in life, you know, it will often show on the scalenes, not just on the SCM, and sometimes it won't show on the SCM and it will show on the scalenes. So the releasing the scalenes allow the lungs to breathe more deeply and calm the nervous system. Sounds like maybe we should turn the heat on? All right. Sorry?
The scalenes are the main stabilizers
of the neck, yeah. Yeah, so therefore it releases the nervous system. Yeah.
I just meant you don't seem to check it as like a primary sort of finding on all people.
Yeah, you're right. I don't, and I should. No, it's a good. I mean, you know, we all have habits. Yeah, but now I'm going to have to. And you're right that there are certain things that I skip. And I go for it when I'm not finding enough, when there's not enough going on, that's when I go for them. So you're absolutely correct.
Like if you suspect SEM, but it's not showing, then you might.
Yeah, or I'm not getting stuff and I'm going, okay, here's the... When you release the SCM, the repercussions, the domino effect is huge. When you release the scalenes, the domino effect is a lot smaller, generally speaking. There are a few people where this is totally primary and knocks down everything. But generally speaking, it's a contributor. For me, it does not seem to be a primary. Okay? But you will get mileage out of it still. So now that you've asked me, now that I'm unconscious, watch how in a few months it's all going to be all about the scalings. Yeah, it's how it works.
So it's like, you know, with all the different reflexes and points, it's hard to be totally present with all of it.
Exactly. That's what I'm saying. You prioritize what people would like to believe that there is a systematic way to check the abdomen. You're supposed to check everybody the same way. It's just not going to happen that way. It just, even though it doesn't take long to check everything, somehow it doesn't, when a patient's on the table, you already prioritize what you think is going to be worthwhile from the symptoms and from the history. And you're going to start getting distracted. It's very hard to keep such cold clinical clarity and go, I'm just checking the abdomen. When I'm finished, I'm going to correlate it. I can't do this, so I'm checking and then I'm getting distracted by some idea. And, what I'm suggesting, the antidote for that is don't needle until you've checked as much as possible. And it's really just as much as possible. It's not, I'm not saying everything because I recognize that you can't check everything. And if you watch Kiiko teach, because she's interested often she's coming and wants to push a certain idea. Okay, so she'll check and then the patient starts saying, and by the way, did you know that I have this? And can you do something about that? Or something's not working. She starts checking the abdomen. And sometimes she's checked very little in the abdomen when she starts in a class. And then afterwards she starts checking more. And sometimes she won't check more because, well, there's no need to. So you have to be flexible about, you don't have to do everything on every person. Ideally, yes. But it's just not, most of us don't have that kind of capacity to stay on track like that. Most of it. So you take what you do the essentials you need, see how far it takes you, and if it didn't take you further, then you press yourself to get more. But if you don't need to, why put the pressure on? So, because if you think you can do everything on everyone, you're becoming like a robot. And it's going to make your life pretty miserable, I believe. Does that make sense? So, all right. Lung 8 is the other point in the arm that we use a fair amount. We use it for numbness with spleen 3 specifically. We use it to release the scalings. And we consider lung 8 to be a point that supplies oxygen in the bloodstream. That's why it's used, for numbness. Now, other points that supply oxygen are lung 4 is used to supply oxygen in the lungs. So the capacity of the lung to expand the lungs. I use lung 4 a lot for people who have rib problems because it opens up the intercostals. Okay, and then. By the way, I often do that for ribs. I use liver 4 and lung 4.
And do you look for lung 4 the way Kiiko does? I think she does. You keep it face forward, and then you bring in this. So
yeah. It's the same thing, but basically, if you move up from lung 5 and you move on the lateral edge of the muscle, you will fall into a depression. You don't, that nose thing. Because the nose thing is, you have to make sure the patient is totally steady because, the Chinese do something else. The Chinese do this for lung 3 or lung whatever. So this sorry, but the Heil Hitler stuff does not work for me. I know, but I'm just, I don't need a nosebleed. Yeah. But how many patients are going to, don't move. It just, so I found, that if I just slide, I can find the point. But yeah, for a general area of where it is, it should be that.
So there's this lung 8 business about, you pinch and things. How do you actually find it effective?
No, I mean, I used to actually do that, but you don't need to. Because if you press very lightly, you're going to feel. Sorry?
Lung 8.
Lung 8, yeah. There used to be this idea that you pinch. Also on spleen 11, you're supposed to pinch. And, I think there are certain masters in Japan that had very fine skills of finding points and stuff, and they tried to discover. But I think what you're really looking for is there's something that's almost like floating there. Like you feel in the tissue, like you'll feel like there's a floatiness to it, and that's kind of like your point. And under the floatiness, there may be a gummy, but you're almost like looking for. So it's going to sound contradictory. You're looking for a floating depression. In other words, it's a depression. It's a depression where the structure has a depression, but on top, there's something that floats on top of that depression.
Is it a vein?
No, in my opinion, it's not a vein. I wouldn't want to. No. First of all, we're talking about lung 8, which is. You actually have that feel. Feel that.
But that's a vein, isn't it?
If you say it's a vein, it's a vein.
It's a vein, yeah.
Spongy actually is a very good description for what I'm trying to say. If it's a vein, then it's a vein. Then apparently it's a vein. I didn't know, because I would have thought we want to avoid veins, but because I know I'm not going into a vein and I'm not bleeding anyone. I've never bled anyone on lung 8. I mean, I've never gotten blood out.
Just go in very little, so you wouldn't necessarily hit it, right?
Yeah, I guess. But there is that weird, that word spongy is definitely, I would agree.
Because if you're using, like for neuropathy where you're numbness or something, it's hard to judge whether you're doing a good job because they can't always feel.
Yeah, okay, so with numbness what I do is I touch them and I say, how far away do you feel my hand? And I ask them to describe it in terms of miles, because not millimeters. Obviously, it feels like it's just a few millimeters away, but so it can be big, and we can have a lot of, room to wiggle the percentages. And then I press on spleen 3, and then I say, okay, and how is it now? I press lung 8, and how, that's how I evaluate it. But yeah, a lot of people with numbness is very hard to treat. Now, some people with numbness, you can get rid of the numbness, and some people you can't. And not all numbness, by the way, is spleen 3, lung 8. That ideology is based on, Nagano said that numbness is a result of lack of oxygen and the blood is too thick, too much sugar in the blood. Okay? But say someone comes and they have numbness because, it comes from the back, the spleen 3, lung 8 may do something, they may be supportive, but that's not your big deal. And if someone has numbness because of, chemo or something, spleen 3, lung 8, again, they're just supporting. It's like, clearing the liver, and then, because it's usually in the legs, it's not always in the legs, stomach chi will be much more powerful than spleen 3, lung 8 for that person's numbness. So the spleen 3, lung 8 is more for the diabetic neuropathy, and we can expand that to other kinds of numbness. But they're not always the main points for numbness. That's something we will always consider adding. Okay?
And the sciatic, tingly, numb.
Well, that you need to resolve either the L5 or the L4, L5, or if it's piriformis syndrome, the piriformis. But you're not. The reason why you'll get some mileage out of spleen 3 here is because spleen 3 is one of the points that releases muscles in general, allows muscles to release. Like we use it for cramps, for example. And in that case, I would also, at that point, consider OD as a helper for spleen 3. But with sciatica, you really need to resolve the root of, the structural issue of the sciatica. And then the other things, by the way, sciatica is not so easy, in my opinion. So the things that, definitely consider for sciatica is kidney 16. I haven't had luck with that?
No.
Okay.
I don't know how really to kind of palpate, kind of get to the area because of their face up. And how do you get round?
Round where?
Well, no, so kidney 6 is a treatment point, but then you're sort of like pressing, sort of like finding the... Do you want me to lie down?
Yeah. No, let's have a cup of coffee and...
Forget this.
Yeah, forget that.
Move on.
Okay. So your sciatica is where?
Say here.
Okay, say here. Okay. So I press here.
Yeah.
And then, where's your navel? Okay, here. Okay. So I press kidney 16. And I press here. What's the problem?
I find
you have a red 9 pulse.
Uncomfortable.
Of course it's uncomfortable.
Hurts my hand a bit, and it's a bit like.
Okay.
Oh.
Do you sit down or stand up when you
I
treat?
stand up.
Okay, so
Sitting down.
yeah, no.
easier.
Okay, yeah, you probably will. But if you stand up, what you need to do is you need lean yourself into the table, because yeah, I understand exactly what you mean. If you're pressing up and there are big guys, for example, it's like
it's hard and
yeah.
you know, big flabby or something like that. Yeah.
Either hard or big flabby. They're all difficult, no matter what they are.
And finding, you know, sort of like the back pain as well in this position. I
Yeah.
think is
So
difficult.
okay. So look, what I'm doing. Okay. So you're relatively small compared to some of these huge people. But you know, like the guy yesterday, I did. You know, it's the same thing. You know, I asked them not to help. Okay, because if they help, they're going to move, and then when they lay back down, I don't know if I got it. So what I do is I just slide the hands down, and I lift them myself, and now I find what I want. Ooh.
And are you
I didn't want that, but
Are you looking for where she has pain?
yeah.
Are
So
you
now my
thinking
hand
of-
is around L2.
Okay.
Okay, and I found pain. Okay, sorry. And now I can have a treatment point, and I can say, how's now? Okay, but once my hand, now the thing is, so once my hand is there, what you don't want to do is you don't want to walk away.
Yeah.
Because then it's just your hand. Remember that the palpation's always my body and not my fingers. The moment you start using your fingers, it's going to hurt. When they have, because you're doing this and they're doing this again, you know, without wanting to. Just the weight does that. So it's not a comfortable situation to be in. I am a little bit bent, but I'm real okay. What I'm doing underneath there is I'm doing this. I'm not moving a huge amount in my fingers.
No.
You know, so but it's totally possible to find the underneath. So you have to figure out what happened to your posture that makes it so uncomfortable.
So you're just lifting, are you, Avi? So you're more lifting rather than pressing.
I'm lifting a little bit, yeah. I mean, well, I'm lifting my hand, but I'm doing this.
Yeah.
You know, and since there's a body there, it's not going to go there. It's going to go, you know, because it. Does that make sense?
So are you going in from the side onto the transverse processes? You're not on
Yeah.
the do channel, for instance?
I can be on the do channel. In her case, I was in the transverse process. You know,
Where would you want to be? Either? Or
either. You're just checking someone's pain. Say they have sciatica, and you're checking their L5, L4, you know, situation. You know, so you go, okay, this is the do. You're jumping everywhere. And this is the what.
check both.
I'm just changing. Yeah, I'll check whatever I can. Now, yes, is it more limited to check from this position? Absolutely correct. Now, the thing about kidney 16 that you want to consider, it's not like your main point for sciatica, but it's something that's helped. While they're on the front, you can address the symptom fairly directly. So you do everything you can to release abdomen. And then, by the way, kidney 16. Okay, then, you know, you can do your gallbladder 31. You know, on the other side, you have more options, and you can check the back more clearly. But it's one more point to add. No one says the kidney 16 is the major point for sciatica. It's probably your best one that addresses sciatica only, you know, clearly addresses the sciatica on the front. Does that make
And
sense?
if you've got adrenal pain, then you're not going to.
Then
clear it first.
clear it first, and yeah, and clear it with whatever you can that will also clear sciatica. You know, because if you have adrenal, you want to choose a kidney point that will also do something for the sciatica, hopefully.
Yeah.
In other words, don't just address the adrenal, address the whole thing as much as you can.
Okay.
Make sense?
Thanks, Alan.
Thanks. Yeah. Tim, why don't we take you now?
Could I ask about moxering around the navel for kidney disease? In the book, do you get anything from that?
Yeah, I mean, supposedly kidney 16 is supposed to relate to the kidneys directly. I get more mileage out of kidney 7 and UB52, quite honestly. Yeah, I can't say. You know, you have to understand, when someone writes a book, first of all, not everything that's in a book is going to apply for everyone. You know, someone writes a book.
Yeah.
And there's a few things that happen. First of all, you have to fill the book.
Yeah.
No, I mean, so you're going to come up with, because if I just told you the things that I really use in my clinic lots, which is what I was trying to do with the points here, then I'm ending up with, there's no book. Who's going to buy this? I need a book. But the other thing is it's reverence to other people. So someone says this point is fabulous for this, and they happen to have a big name. Well, you're going to start, you're going to put it in the book because someone, it may not work for me, but it might be really useful for someone else.
How do I know that that's being useful? That's the thing.
Well, and that's the biggest problem with that book, is that what they've done is they haven't differentiated between what's really essential. And so people say to people, this is one of the biggest arguments that I have with people. They say, liver 1 is for cardiac. I'm like, liver 1's not for cardiac. Where do you get that? Well, Kiiko, I said, yeah. There's this idea, liver 1 can be good for cardiac, and liver is mother of fire, right? So in some cases, liver 1 can be a good supporting point for cardiac issues, but you can't make suddenly liver 1 is the point for cardiac. So the book was written in a way that wasn't quite, sometimes you can tell this is a supporting point, this is a main point, but it's not that clear. And the thing is, you're not going to know until, so if you try and learn the style from the book, and you haven't seen Kiiko, people come up with all these ideas. And I'm like, well, I've never seen her do this. And I'm like, yeah, I know, that's what, so you can't learn acupuncture from a book. You've got to learn it from, you've got to see what's really being used. Yeah, and that's a fair thing, but so my suggestion is forget the just in case.